Welcome everyone to our first work in progress of the fall semester. It's great to be back and have everybody here. It's nice to see everyone. We have Matt Cahillane with us today. He's going to talk about the effectiveness and limits of TIC education interventions. Matt has expertise in public health, environmental sciences, and climate change. He's worked in public health for 3 decades in disease surveillance, environmental pollution, and supporting local health inspectors. He provides training and education on tick-safe practices that are based on current research evidence and practical experience working in tick habitat as a landscaper, and he pursues local and state policies to reduce the risk of tick bites. His educational background includes a bachelor's degree in preventative health studies from UMass Amherst, where we are now, and a master of public health from UCLA. Matt is the owner of Ecological Solutions based in Concord, New Hampshire, and a member of the advisory boards for both Tick-Free New Hampshire and New Hampshire Healthy Climate, excuse me. So welcome, Matt. Thank you for joining us.
Thank you, Jane, and good morning. Thanks to Steve and Rich and the new VEC for inviting me here today. Looking forward to your feedback, so open up your chat tool and provide feedback as we go along. I'll respond to get ready to respond to a few questions I'll have for you, which will be fairly straightforward. First today, let's talk about our roadmap, what we're going to learn. So really, we're going to talk about an overview of proposed TIC Train the Trainer or Training of Trainers intervention that we're proposing here through NUVEC. We're going to ground the intervention in evidence, which we'll cover today, which is public acceptance of tick safety, effectiveness of tick personal protective measures, effectiveness of education in that term, and public misconceptions about ticks and tick-borne disease, the limits of educational intervention. And as we go along, as I said, we'll engage you all in the discussion. And let's talk about a little terminology so we're all on the same page. I think most of you are probably very familiar with these terms, but we'll put them up here just in case you've got a better definition you want to share with us. Personal protective measures are those measures we know about avoiding habitat, wearing clothing, using repellents, using permethrin, drying clothes, practicing tick checks, bathing and showering. So those are all the things that we think of as PPMs, and I'll try to abbreviate as I can along the way so we can get through a number of studies that I want to cover with you. CAPS, or knowledge, attitudes, and practices, is examples of knowing what we do. It's kind of how we assess what people know, how they feel if they practice PPMs. Education and communications are the strategies we use to transfer PPMs and other skills to people. Effectiveness and efficiency really is about different ways of determining if these strategies and methods work well. And finally, trust and distrust of the information or the experts are important factors in whether our messages are received and accepted by people. So we'll go on now and talk about why you should trust me, right? That's a perfect segue. You've heard I'm from New Hampshire, and you can see down the left-hand side, it talks about welcome to New Hampshire, live free or die. That's our motto. There's a lot of libertarian flair in our politics and our people here. And I like to start off talking about myself, as I'm dedicated to helping people reduce the burdens of tick-borne disease, right, while preserving personal freedoms. That's important for people here. I think we see in this country it's arising everywhere. People are talking a lot more about what they will and won't accept. We need to talk about that in relation to ticks and tick safety. As mentioned before, I have personal experience as an athlete, hunter, landscaper. That keeps me in tick habitat a lot. I have 3 decades of experience in state and local public health, published a few studies on interventions, which you can look me up on Google Scholar. I've collaborated with John Snow Institute and Tick-Free New Hampshire on 3 interventions to train youth and adult instructors to be tick safe. I'm currently teaching tick bite prevention to outdoor workers and other audiences. And if things go well, we're pursuing policy change here in New Hampshire to support PPMs and repellent availability to state agency workers. So policy is something we're not going to talk about a lot today, but it's another key way we can address tick-borne disease and tick exposure. So let's talk also a little bit about those 3 interventions, just so you get a sense of it. Back when I was working for the State Department of Health in New Hampshire, We were lucky enough to have a grant, and I was a principal investigator looking into climate and health issues for about 10 years. We used those funds through CDC to do a training of youth and youth educators, day camp counselors in the Lakes region. We also did a little later a Seacoast area ticks and youth, mostly with after school and camp caretakers, we'll call them, a little bit of an older group. This was high school folks. This is young adults, college age. And then after our experience with those two, we started developing a train the trainer. So with the idea that we could create a cadre of instructors that would spread across the whole state. And we'll talk a bit more about that. But it was semi-effective. We needed improvements in how we evaluated it, and we can talk about that as we get through. Next, we're going to talk about potential design elements. So I wasn't able to animate this well, so I think there's a lot going on at once. But if you look at the left-hand side, it shows the inputs, right? If you're used to logic model ideas, this is what we put in: labor and materials and to some degree design to get to that training of trainers course development. We need to think about curriculum reviews, what has been done before by smart people or people smarter than us. We need to talk about public misperceptions and prior experience with the trainer, as I just mentioned. And we want to interview subject matter experts and target audience to make sure we know their wants and needs and we know the best available evidence. We'd like to innovate a bit, and we'll talk about some of that later. And we'd like a theory of change, something that grounds us in what we know works. And our second part, we're going to do our implementation and outreach efforts, beta test a curriculum with the project team and hopefully peers from our target group of co-op extension workers, implement it within the target audience and evaluate the inputs, outcomes, the whole program as best possible. And if we do that all well, outcomes based on a theory of change, we'll have some pre-post testing of the knowledge, attitudes and practices. We'll have some innovative measures, maybe around trust building, critical thinking, misperception of risk, and we hope a cadre of instructors supporting a larger geographic area in Massachusetts initially, and then we hope further. In terms of the project itself, 2 phases: one, September through December of this year, reviewing the research, reviewing available curriculum, and developing a high quality curriculum that will train instructors over about 3 hours in order to present a 1-hour course to the at-risk audiences. In the second phase, we'll test that curriculum among peers, implement it among extension staff, support the outreach of the instructors, because I find people really want to know they've got experts behind them, evaluate the change in knowledge and practices, and maybe some other variables. And if successful, let's try to replicate it across other New England states. So having kind of thought through what we plan to do, well, we need to look into what supports doing these activities. So let's look at kind of the proposed beginning literature review, what criteria I'm putting forward. And this is, flexible at this point. So looking for input. And the research question right now is how effective are education interventions in changing those caps related to ticks, tick bites, or tick-borne disease. And I have a few inclusion criteria, which include the study should be published on or after 2012, although there's some exceptions to that in English, be empirical research or systemic review, be about tick bites or disease in adult humans, be focused on primary prevention of tick exposure and bites and illness, not be focused on the secondary prevention, because there's a lot out there in the tick literature, so I'm trying to make it a little smaller. And be focused on the evaluation of education or communication strategies. Those outcomes, did it work, is where we want to go. So that gives us a little bit of a launching pad and a background for looking at some of the literature I've found so far. What's the problem? Before we get to that, we'll talk a little more. There is a high incidence of tick-borne disease and low to moderate uptake of preventive behaviors by the public. There's limited evidence for the effectiveness of those PPMs in the real world, and there's limited evidence for the effectiveness of education and communication interventions. There's been a change in public trust and perceptions of tick risks, and it's merely not, I'm calling it not a wicked problem, right? There's not a real high complexity to the exposure and the protections from those, nor are there big cultural and economic barriers to action. You're welcome to challenge me on that. That's why we're here today, to learn about it. But I'm going to say it's more straightforward than obesity, more straightforward than some of the other ones that we have going on for large public health problems. Okay, let's look at some of the aspects, the evidence for tick-safe use. This is evidence actually among the public. What is the level of acceptance of these practices? Two ones I found that I thought were most recent, being one in 21 and one in 2023. This first one by Narwaki had over 10,000 people in the sample size across the entire USA from 2013 to 2015. Survey questions about 3 different areas. What's your experience with bites and diagnosis? What's your experience with personal protection? And what's your willingness to vaccinate? Very interesting back at that time. Findings vary by low and high incidence states, right? You'd expect people in higher incidence states to have more of these practices, and that varies, but generally true. And it ranges from 46 to 53.9% reporting using these PPMs. Yet that still translates to 45%, over 45% not consistently using this protection. Okay. Lower PPM use was associated with people over 75, higher income, and urban living. Higher income doesn't make sense to me. Urban living does, but we can talk more about those possible reasons. Second point of evidence is Cudera in 2023. This is in Long Island, New York. Sample of about just over 800 people. Findings indicate that with a higher level of concern is associated with higher use of PPMs and the ability or the intent to pay for domestic tick control. So we have both that personal and that environmental, both personal in some ways. And the 2 study sites, 45 to 52% of respondents applied repellents, never, rarely, or sometimes. So that's fairly low compared to what we'd like. And now we're going to talk a little bit about what we'd like. We've got 18 or more experts in the room with practical experience and some research experience. And I'm curious to hear from you what you think. So, here you can, as you ponder this idea, think about population level use of these PPMs by adults, not individual level. And also consider any changes you've observed in levels of trust you've observed since the 2016 election cycle or the 2020 pandemic response. The question I really have for you is, what's the recommended level of PPMs for the health experts here today, right? Your hint is we know that 47 to 54% in the largest study is the acceptability with the public or the current level they can perform. Do you think it should be 60, 70, 80, 90, 100%? Where do you think we should be shooting for? That helps me understand as we evaluate these trainings and the changes people have, whether that's, let me go back, whether that's a reasonable amount. If you're thinking 60%, the low end is about right. That I want to know. If you think 90 or 100% is where we should be going and can go, that would be interesting too. So, Jane, are you seeing anything in the chat yet around what people think should be the recommended level for the population?
I have a couple of responses now, if you'd like me to hear them.
Yep, actually, they're popping up on my screen right now, and I see Andrew Lover saying likely needs to be 80 to 90%, but I can't read the rest of it. It just disappeared. So
Okay,
that's great.
I'll read them to you. Yeah, so I have Jeff has said asked 80% if that's correct, and Andrew says 80 to 90% to show a major drop in incidence, but 60% is likely a realistic target.
Yep, that's really what the evidence is saying right now. But I want to hear what people think. That 89% would hit that point where we begin to see a drop in incidence, which is what we want. And I won't speak to it. It'd be interesting to hear what Dr. Lover says, but it'd be interesting to know if it's increasing or decreasing the incidence over time. In New Hampshire, it seems relatively flat over time, but pandemic in the midst of all that changed the data. So I'm not sure. Happy to hear what people think about that. So that's our first question. It's a group effort trying to get a sense for what you think.
I have one more response if you'd like to hear it as well, Matt.
Sure.
So Chad Pearson says, I think I would want to know a little more about which PPMs we are talking about exactly, like are permethrin treated clothing and DEET repellent when going out interchangeable or 2 options. And he says, I'd like to see at least 80%. I think this would be a big success.
Good. I did mention some of the ppms in the last slide. We'll go back to that at some point, but we're about to look into the evidence for the ppms. This was overall use, I believe, of any ppm, but they vary by study, and that's the problem we have right now is we don't have a systemic review that I know of or a meta-analysis of all the surveys of practices. But if they're there, pop them into the chat if you have that study, or you can email it later. All right, so now let's look at some evidence for the use of specific ppms. Which ones? That question just came up. 2 recent literature reviews that assess public use of ppms. The first is from Lars Eisen, who's on the call today, which is great. And it focuses on the level of use of specific ppms. So that's kind of a blend of acceptability and behavior. He reviewed dozens of studies on surveys and interventions. The public commonly takes preventive action by number 1, wearing untreated clothing or conducting tick checks. That's 30 to 70%. Pretty wide range, but it gives us a sense. 2, showering or bathing or using repellents. That's the second thing people go to if they're looking to prevent tick exposure. And then at the low end, permethrin-treated clothing was the least used preventive method, under 5 to 20% range. Has that changed since 22? Probably not that much, or since those studies, I should say. I'd be curious to know if it's changed. These results are mixed for each personal measure, and some studies indicate the regular use of the measure is associated with a reduction in tick-borne disease, while other studies found no similar protective effect. All right, so there's some limitations in the studies that were reviewed there. Second one was Schwartz, and also in 2022, a focus was to examine the effectiveness of recommended ppm to prevent Lyme and other tick-borne disease. So this comes down to only 16 studies. I believe their outcomes were specifically for tick-borne disease, but I need to dig into that further and compare it. So here results indicate basically no intervention was predominantly or consistently effective across all the studies. That currently there's no single best method for primary prevention of these anxieties transmitted diseases in the United States. So some challenges in the limitations of our data there. And next we're going to look at evidence for misperception of risk. Why might people not be practicing these recommended procedures? This is a study that looks specifically at misperception of risk, and this could be misperception. It could also be considered to be low trust or rejection of the trade-offs, right? The trade-off of not getting a tick-borne disease versus applying a repellent that they might not feel comfortable with. So finding indicated, fortunately, that 83% of respondents identified experts such as us and agencies as trustworthy sources of prevention information. Yet, more than 50% of participants revealed distrustful attitudes or were uncertain about CDC-supported statements related to 3 topic areas. One is time to transmission, is believed to be over 24 hours. In the studies we've had, 59.5% people were distrustful or uncertain about that. The safety of DEET repellent specifically for children, over 50% were distrustful or uncertain about that. And finally, recommended use of antibiotic prophylaxis after a bite before illness symptoms was 65%. So people are not trustful of that. Maybe that trade-off of taking an antibiotic versus experiencing the illness was not there for them. So distrust was associated with variables that included high rates of social media use, which means even though they trust us, right, they have a trusted source in their friends online, a more trusted source. Less confidence in their ability to protect themselves from tick bites. So that comes back to self-efficacy, which we'll talk about a little more, but generally means they feel confident that what they apply will work. So some of that makes sense. We know where our challenges are. If we're going to up these rates, we're going to have to reduce some of these misperceptions that are there. All right, we're going to go on to another group effort. So I hope you're ready to type into the chat now. This is where we have a table with the first line, the first column is a personal protective method. The second one is a rank, why you rank it that way. And the third one is the public use range. And this comes from Lars Eisen's paper in 2022. So please use your chat function, enter your own ranking of 1, 2, and 3. While I talk about why I ranked mine. for me, ranking number one is using repellents. Two was wearing permethrin-treated clothing, and three was practicing bathing or showers. Really, I think they're the most acceptable and effective ways to treat it. In my personal experience, right, and also what I've read. And the nice thing about repellents and using permethrin clothing is they're both flexible, and in case of permethrin, long-lasting, which for me as a landscaper, when I'm doing that, matters a lot. I don't want to have to go back and apply it or think about applying it when I'm, all going into tick habitat. Why not the others? I think in terms of wearing untreated clothing, or actually avoiding tick habitat, most of the people I know can't or won't avoid tick habitat, right? They're either outdoor athletes or they're workers, or they're trying to enjoy life with their kids outdoors, and they're going to be in and out of it at some point in their activity. The second one about wearing untreated clothing, I think most people doff or get rid of protective clothing in hot conditions. As soon as I get over 70 degrees, 75 degrees of perceived temperature, off comes long pants and long shirts, right? And I'm left with using repellents or other things to protect myself. And finally, practicing tick checks. I think visual tick checks, which versus a shower, which I consider to be a tactile tick check, may not be effective for the nymph season or for certain people. If you've got to do a visual tick check, you've got to have good eyesight. You've got to have flexibility to reach down and see things. You need to have bright light. There's all these things that come in. And I think that all of that can be managed by taking off your clothes and taking a shower. So for me, it's higher on the list. I'm seeing some ones coming in. Number one, tick checks. Number two, permethrin. Number three, repellents. Somewhat reflects what I thought. As these are coming in, I don't see a lot. And you're welcome to unmute and talk about this if you'd like. If there's something here that's challenging or something that's surprising or something you want to confirm, go right ahead. I see Steven's there with number one, tick checks. Number two, wearing protective clothing, or permethrin clothing it was. Yep, I hear that. Somebody's saying, Veronica, I think, is saying there's a lot of pushback of using it.
I can read that for you, Matt. She says there's a lot of pushback against using permethrin when she's speaking with folks in the public, that there's a fear that it's toxic or carcinogenic.
Good. All right, let's keep going through.
Yeah.
Evidence for education outreach. I was able to find two different systemic reviews that looked at this issue of what do we know about education and how it works. Basically, Richardson of 2018, they found the problem they identified was few high-quality tick education studies, which suggested, they had 3 tick studies, which basically included leaflets, mail, live show, may increase knowledge, CAPS, and behavioral intent. One study may increase protective behavior, and one education live show, which is the famous one going out to, I believe, Nantucket, may reduce the incidence of Lyme disease. That was an outcome that rarely was measured, but that was a positive one, at least for long-term residents. Then the best one I found was from 2012, which was Mowbray, ticking all the boxes, a systemic review of education and communication. I thought that one did a great job of covering where we are right now with tick education. So identified the problem of low uptake of protective behaviors and limited understanding of tick education, emphasized the studies often lack a clear theory of change. The methods they used were searching electronic databases, coming up with key seminal studies, and engaging with their experts on these. And the results were they discovered 9 individual studies with before, after, or controlled trial designs, so higher quality designs and efforts. And the education strategies include a mix of those active classroom styles you're used to, passive information sharing, and more interactive social media. So using my criteria for this for this literature review, I came up with 2 different studies identified here. One was in Gould, 2008. Test sites were in Connecticut health districts, and they had a before and after design of about 400 participants over 5 years with multiple test sites. So a lot of elements going on here. And the target audience was health department staff. The results indicated that in 2 regions, people were more likely to report increased knowledge, the feelings of risk, and that engagement in practices. In one region, the campaign appeared to be counterproductive, reducing knowledge and decreasing perceptions about risk in catching the disease. So good report to know that it varies in different regions, or there was something big going on temporally, spatially, in the news for that area that changed things. The other one was Daltroy. This is the one we mentioned about that Nantucket Island Ferry, where they did a very engaging show and theatrical show to over 13,000 participants over multiple years, with a 2-month follow-up survey. Results showed no overall significant difference was detected in the self-report of tick-borne illness between the experimental controls, although there was evidence of lower rates of illness among a subgroup of participants classified as long-term visitors to the island. So people who were there longer likely talked with people and discovered the risk was widespread, but uncertain exactly why there. Suggestions they had for future research really is first need to better determine the effects of interventions, likely through randomized controlled. We find those are the most effective. A need more survey validation, as most studies are self-reported behavior. A need to measure competencies such as knowledge, attitudes, and practices. Multiple competencies, I should say. Most did that, but a few studies just measured knowledge. A need to design and evaluate with multiple audiences in mind in order to determine the effect on various at-risk subpopulations. A need to follow for multiple follow-up periods to determine the stickiness of those interventions that were used, and a need for behavioral theories to inform the project development and implementation, and finally a need for higher quality reporting of specific activities. So we can replicate these studies, including better descriptions of the intervention and outcome variables. So those are the things in future research and that I've been thinking about and looking towards. So next, I found 4 additional studies that had either usually a pre-post design, some type of controlled environment, controlled way of testing if things changed between 2012 and 2024. Again, if you have more than this, please post them to the chat or send them along by email. The first 2 were performed in Canada, in Quebec region, and the second 2 were performed in Illinois. Some of them shared similar authors, some of them didn't, so I'm kind of curious to dig in further and find out more. This Forrest Bernard from 2021, the first study at the top here, talks about an N of 18 for the tick instructors, a post-survey of those knowledge, attitudes, and practices among park workers. They trained again or engaged with another 1,860 participants. The results indicated intervention was a feasible strategy to create a cadre of instructors to train the public in these practices, these outcomes, and tick drags. They chose that as kind of a dual component. I was unclear as I read it about the changes in knowledge, attitude, and practices. It seemed to be more focused on getting people into the program than determining if there was a change. The next one is POTS in 2023. This had 37 participants with a pre-post surveys and key informant interviews afterwards. Study sites in Canada, and this dual kind of personal protective practices and environmental changes on the property. Results indicate there's a high level of participation. Those with a higher level of participation in intervention activities were associated with a higher adoption of those measures. That's great. Seeing at least one study show that wasn't true. That's a helpful outcome. The second 2, as I mentioned, were from Illinois. This first one by Chakraborty in 2024 had 93 adults trained. They did a pre-post survey among extension workers, which is the target audience we're thinking about. And the results indicated that post-intervention participants reported higher knowledge, increased confidence to engage in the public. Knowledge increased to both groups among professionals as well as volunteers, because they had both in this group. And the professionals were more likely than the volunteers to report knowing a lot about ticks. So that would make sense, right? Professionals usually would, as opposed to people that are volunteer to come in and be with extension workers for a training. The last study here is Lions in 2022, 56 people involved in that with a pre-post survey of local public health workers. So this was 6 study sites in Illinois. I expect regional health departments. Results indicated an average knowledge score increased by 8 points out of 26 from pre to post. Attitude scores increased from basically by 5 and a third points out of 60 from pre-post training, there were no significant differences in practice scores. So how people practice these outside. So some challenges there in understanding it, but we have 4 new studies since that 2012 review, which we can use and hopefully reach out to authors, learn about what they did, maybe borrow some of their either curriculum skills or their evaluation components. That would be wonderful if we could adapt those to our needs here and not have to develop new. So I think it's our last group effort. What are your education priorities and why? Use your chat now to the chat function into your ranking of 1 to 3 while I talk through what mine are and why I did a ranking. So my PPMs, or I shouldn't say PPMs, I should say my approaches here for the different educational interventions or strategies. Mine are based on my experience, some evidence and to some degree policy. I like group discussion. I think from an adult education theory and practices standpoint, adults are informed, have a background, and always want to discuss. If they're not given that opportunity, their interest drops quite a bit. And that's from my work with the New Hampshire Landscape Association and my student evaluation feedbacks I got there. They like the discussion more than the lecture. My second one was workplace safety rules. I believe policy is great because when you get it engaged with leadership, then you get a longer term investment in that, and you usually get budget that come along with it, sustaining over multiple years. And in this case, often not only are they getting training, but they're also getting either personal protective equipment or repellents. That's why it's my number 2. And number 3, myths and misperceptions of tick risks. I'm really, my experience of students is that they want to be involved with the controversies. And my interest in understanding political polarization and how that's affecting public health tells me I need to engage in some way with that trust, right? To understand what's out there, listen to it, engage with it, hear it, if I'm going to understand it and be able to work with it. This may be one of the biggest limits we have, right, to moving forward. We're not sure. We've just been exploring that more in the last few years. The reason I didn't choose the others is I feel that lectures are often passive learning, not as good for adults. Self-efficacy in the CAPS can be difficult to measure. That's why I didn't put it at the top. We will measure it, but I didn't think it was like the top thing I wanted to invest in for design. And then self-efficacy in teaching. Teaching people to be teachers can be difficult. And I need to read in a lot more to that to find out how I've done it well in the past, how we can do it better in the future. So I'm not seeing any of the chat that's coming in, but if anybody wants to read those out or unmute, you're welcome to do that now.
Yeah, Jeff said that myths, group discussion, and other strategies. And Caitlin asked, what about hands-on active learning?
Yeah, developing skill stations to do that. That wasn't included here, but it should be. At the bottom, actually other educational strategies, and I have done some of that. Let's move on and talk about the limitations of the evidence, right? We only have 2 systemic reviews of TIC education and communication efforts. It's Mowbray and Richardson. Meta-analyses of similar methods or results were not found. So if you have a meta-analysis out there that talks about TIC education and compares in between, I would love to see that, but I wasn't able to find it. This is a small number of high-quality studies, pre and post, with evidence for effectiveness. We don't have many yet. I've discovered 6, I'd say, at this point. There's probably more, and please share anything you have. Sample size for the training participants is relatively low, 16 and 93 in the most recent studies. No clear set of standards or competencies for individual participants in TIC education. I actually have a slide on this, but I think I hit it, and I'll need to pull that back up. But there's a set of competencies that come out of the 2018 HHS Tick-Borne Disease Working Group, and that was 9 or 10 things I think we should essentially have in there. We've covered a lot of them today around people understanding the effectiveness of repellents, understanding the effectiveness of those processes we use, as well as integrating in those social science theories for change. And the other one is out of Connecticut. I found a newsletter that provided guidance on how to develop a job hazard analysis. That was just 3. I'm going to see if I can pull it up as we begin our discussion, which said basically you need to have a policy in place and funded. You need to have some training. And I'll come up with a third one by the time we get there. No clear indication of which educational strategies are most effective, and no clear indication of which behavioral change theories are most effective. And as a last slide, I think, I wanted to bring out that idea of the communication model. We've talked mostly about the receiver and the messages here, a little bit about the noise, right? The misperceptions of those, and a little bit about the channels. So those listed educational strategies are the channels we go through to bring our messages across. But we haven't talked a lot about the sender. There was some evaluation of the people who were trained, but I always feel like a missing point is evaluating that, and I hope to do that better in the future to understand it. And also no measure of, when we talk about the sender, it could be us, right? We could be the reason that we have these limitations in trust or limitations in raising up this acceptance of them. So I always like to put in your funders and such subject matter experts. As an example, I recently got, or my mother got, a tick prevention, a tick risk pamphlet from Massachusetts. And in there, they had one page, all paragraphs writing about the different types of repellents that work, and then a full page with the dangers of repellents and the dangers of DEET with exclamation points and a whole list of what could be a problem. And I kind of wish they had switched that and talked about DEET is effective, DEET is safe for kids, for adults. The evidence shows that it's safe for lactating women. The Poison Prevention or Poison Control Center information says that there's very few overexposures across the state. So I'd love to really emphasize that, and at the end say, read the instructions for your product, rather than having a complicated message or a contradictory message which says use repellents, but they're really dangerous, right? If you spray them on your cuts, if you spray them under clothes. I'm not sure if there's evidence for that, but those are the kind of things I want to get into and understand a little bit better. Evidence indicates some educational strategies may be effective for increasing protection practices and possibly reducing Lyme disease in some cases, or tick-borne disease. A successful education program needs to be built on multiple foundations. So we need to know the public's level of use, the effectiveness, the misperceptions of risks, and adult principles or adult educational principles, so we know we're getting the message across in the right way that people want. There's a need to standardize educational competencies for adults and workers, and a need for more creative evaluation strategies to assess these communication models. And you've heard about many of those today. So I think I'm going to wrap up there. Please unmute, open your mic, and we'll kind of talk about a couple of questions. What's missing from this review? Who's missing? Right? Who else should be in the room to talk about it? And what innovations might improve outcomes? I'd be interested to hear your thoughts on all those things.
Yeah, please feel free to ask any questions, respond to these discussion questions, or drop anything in the chat and I can read it out.
Yeah, I'm Blake Dinius, so I should probably just introduce myself. But one of the things that I think it would be really difficult to measure, but probably pretty important to focus on, is how much of this education is getting to kids. I noticed that a lot of the focus is on changing adult behavior, but at least what I see in and around my county is that the kids, they're easier to teach and their behavior changes are different than the adults. Just as an example, there's this some school systems in my area I go into every year, and we're seeing kids in that I taught in third grade, where they're now in sixth and seventh grade, are doing these things. But you're not going to see that evidence for a long time. Not only is it really just hard to run studies on minors, but I mean, a lot of that change it's like decades out, so you're going to see these changes. You're going to see reductions. You're going to see it's like a long-term thing that I think is really hard to measure, but at least we're seeing it happen here in my county in Massachusetts, which is kind of cool. But I would say, at least from this review, a lot of that stuff is the who is missing. I think it falls under that. So I just wanted to bring that up. I guess, as a comment.
I appreciate that, Blake. And I have looked at some of those studies that try to measure change in children. Nancy Shattuck published one, I think, about 5 to 10 years ago that looked specific at the North Shore of Boston and did a significant intervention over multiple years and significant budget size and was able to show 3, 5, 8% change in knowledge. And I'm not sure how they had challenges or how they had, the periods for follow-up to see how sticky it was and how it stayed. I'm concerned that I'd almost rather train kids in critical thinking and STEM than to focus in on another effort that's expensive and does that, because I just feel very challenging for kids. But I like to hear from other subject matter experts here who may have seen much more positive results. But I had to keep this focused on adults for now.
So Matt, thanks for a really interesting, comprehensive, thoughtful presentation. I really enjoyed that. And I appreciate very much that Nuvek and you are engaging in this type of activity, because I think it's a very worthwhile endeavor, getting information out and training trainers and getting the word out to people. That's really good. The one thing while reviewing studies on the effectiveness of these personal protection measures to reduce tick-borne disease, I was pretty frustrated by how weak the knowledge base and how weak the studies were. Most of the studies looking at if a certain measure actually prevents tick-borne disease were part of a much broader survey of all kinds of things that may be impacting tick-borne disease. So questions about specific methods like use of repellents were very, very, very simple and straightforward. Do you use repellents? And then in the best case scenario, how often do you use repellents? Do you use them sometimes, always, never? But no detail about reapplication, what part of the body you put them on. So just very, very crude information, lacking in depth and detail. And I think the other thing that irritated me when I looked at those studies was that it seemed like it was all univariate. Do you use tick checks? Yes or no, without any thought of, did you use another measure that essentially achieved the same thing, and that's why you didn't do a tick check, because you had a repellent on. So there was no multivariate analysis. Most of these studies are pretty old. So I think that evidence base really is really weak, and it's painful because I think it undervalues the use of these methods just based on how crappy the evidence base is. But it's, you have to work with the evidence base you have when you try to. But I think trying to improve that too is important. So just some random thoughts there. But I really appreciate what you're doing, and I enjoyed the presentation.
Great. Well, Lars, you were one of my target audiences for the presentation. As I read through all of the things you've published, I'm like, wow, this person has really dug in and tried to explore some of those difficult issues, including use of biological formulations, herbal formulations, for those. And I really work hard in New Hampshire to say not use a repellent, but use one of these 3 EPA-approved repellents, DEET, Picaridin, or oil of lemon eucalyptus, because I don't see enough evidence for the others or availability for the others. So I'm trying to focus it in so when we ask a question up here, we can say, which do you use and how often, getting out of that univariate place of yes or no repellent to, am I using an effective one? Because people may be using citronella. I don't know when they're out there, but I tell them if they do, put it away, because the trade-off of using a botanical versus a synthetic, it's not worth it. But we're working on messaging there.
Yeah, thanks, Matt.
May I have
yeah.
maybe it's I really appreciate all the slides, it's very good presentation. Um, for the standardized everything like education items, I think it's very important, like Lars said, what part of the body you use for repellent. This I see some people they just spray to their back, and if you go to the Home Depot, um, the DEET we always tell the people use the DEET, but those products, the DEET concentration is, if you go to Home Depot or to go to Walmart, it's from 5% to like 40 to 70%. But those low concentration ones only last less than an hour. So the people don't, if we only tell them use DEET, the people don't know what kind of, they don't know only high concentration will last. So when you
Yes.
go to hiking, yeah, it makes a huge difference. So I really like your method, I think standardize those things is very important. Thank you.
It is. And I last month I bought about $200 worth of repellents because I want to get them out to my classes and use them with my family too. And I put together what I call Tick six packs, which is highly effective DEET, Picard and oil of eucalyptus with some sunscreen and a tick removal kit and capture for specimens. So I'm trying to get people to think of putting things in place and having the most effective products in them. And I one of the things when I purchased it, because it said, low DEET, or it was powder formula, and some people don't like the feel of it, so I wanted to try it, was 15% DEET. And like you, I said, well, how long is that going to last? Probably less than 4 hours. There's this big emphasis of people saying DEET free on a lot of their products now. And I really think it sends the wrong message. Maybe that's where we're going wrong, is by giving these contradictory messages around what's effective and helpful. It's almost like saying, well, there have been issues with DEET in the past. I know what those are. I've read about the the reviews of those, but they're so rare. The number of applications of DEET we have is so huge per year, and the number of adverse effects is so low. I feel like I want to have an entire education campaign on that. It just has to be done in the right way so people aren't threatened by it. They feel like they're heard and they're acknowledged. And I want to almost have an economic argument. The more DEET you buy, within a certain level, the better return on investment you have. Something like that. So thank you for that comment. Around the idea of innovations, I've been trying to read through Stephen Rich's research over the last couple of weeks, and just yesterday I came up with your application of a repellent that's actually worn on the body and activated through a phone app. I'd be really curious to hear about that as an innovation, and where you are or how you came to that idea.
Yeah, that was some work we did in collaboration with Noel Elman, who developed this device with the U.S. military using transflutrin and metaflutrin. Yeah, we could talk more about how it's used and what its applications are.
Okay. Thank you. Anything else that came up for people that didn't sit right or you had an idea for? This is my opportunity to gather from you what needs to happen. I don't know if I heard any names of people. I heard people say we need to kind of talk to people who work with youth. And that's true. We have to talk and get teachers in the room, and I need to talk with extension workers and find out what portion of their audience is going to be adults. And then how many of those adults are going to be either teaching or caretaking for children, right? Because one of the reasons I don't engage a lot with that youth audience is I assume that their parents really are in charge, or the caretakers are in charge of applying their repellents and other things. And that's the group I want to get to the parents, to say, have it available, have the 3 most effective ones, and apply it in these cases. So that parent and caretaker group is an interesting one, I hope, for caretakers.
I definitely agree with the kid perspective, right? And just making sure that we're reaching children early. for those preventative behaviors. I wanted to throw in there, just from my time, I've worked across various forms of outreach structures, right? Including public health, and non-English speaking, I think, is just a large population of folks that we are not communicating well to. Some of the organizations I've worked for have used things like Google Translate and things to try and communicate products, right? But it's not correct. It's not a correct translation to get the information across and make sure that we're protecting everyone. The other hill that I will die on, I'm now in New England, so I don't know if I can say it. The other tick species, right? So like, so many of these studies are so black-legged tick focused, and
Yep.
Lyme disease is a big issue, but Lone Stars are on the move, Longhorn ticks are on the move, right? Dogs ticks are still hanging on. We've got all these other tick species that the efficacy of all of these different preventative measures or innovations may need to be tailored differently to different ticks based on their behavior, their ecology. There's so many layers to this. So that's my advocacy for more than the black-legged tick. That's something that I'm always curious about when we put a lot of effort into tick education. Lone Stars are just so aggressive. And so when they are in new areas, folks aren't always ready. And DEET, frankly, it does not work very well, at least from personal experience, on Lone Star ticks.
Good to hear that.
My best friend.
Wait, who is your best friend?
Permethrin,
Yes.
however, yes, yeah, has been consistent across all my walks of life. Thank you. This is really interesting.
It is, and that whole idea of all tick species is interesting. And there's something, if there's an author on from that HHS report in 2018 where they talked about, I think they call it common thread education, where they say all people should know about all species in all parts of the countries because we all travel. And I'm having a hard time wrapping my mind around that, just trying to focus on New England, right, and all our challenges here, and the evolving species and pathogens that are hitting New England. I'm trying to think of, like, what is that education strategy, and how much will I get return on investment for teaching all that within a class?
Thank you, Matt. We're just over time here, so I'm gonna thank everyone and let everybody go. But that was great. Thank you for joining us. And our next work in progress meeting will be on September 24th, and we'll hear from Guangzhou. So thanks everyone, and we'll see you then.